are answering all of your viewer questions because there are some really big health headlines out there right now, and lots of you wrote in asking about them. And thankfully, no offense, Al, we have an actual medical professional here to help.
Let it slide this time.
Thank you so much. To the bottom of your questions, ladies and gentlemen, Dr. Kohli, thank you so much for being here.
Hey guys.
Thank you so much.
So, Dr. Kohli, we've received a ton of questions about the new weight loss drugs, and there's some exciting news about one of them, Wegovy. So tell us about this.
Yeah, a lot of my patients have been asking me about this too. So Wegovy, semaglutide, was originally studied as a diabetes drug. While they were studying it for diabetes, people's weight started melting off. So then we said, oh, maybe this is an obesity drug. So then it got studied as an obesity drug just to get the weight off. This latest trial actually looks to say if you treat somebody's obesity, are you actually going to prevent heart attacks, strokes, and heart disease deaths?
Lord.
And that's what this trial showed. 17,000 or more patients that they studied for over 5 years. They give them this medicine, helps them lose weight, but it doesn't just help them lose weight, it prevents strokes and heart attacks, which I have to tell you, patients come into my office and say, I would rather die than have a stroke.
Wow.
And so I think now that we have a medication that doesn't just get the weight off, but actually reduces these really what we call hard outcomes, it's a game changer.
Wow.
Doc, I have to ask you, and I don't want you to feel like you have to be hyperbolic, but is this the biggest wonder drug you've seen in your career?
We're calling this a landmark trial, Al, because this is really, it's turned the entire concept of obesity medicine on its head. And up until now, every obesity medicine drug that we studied in clinical trials, guys, it not only failed, it caused harm. And so our only two options for treating patients that had excess weight was get off the couch and start exercising, or go for bariatric surgery, gastric bypass surgery, which is, surgical option. But now that we have these medical options, which are reducing risk on the level of cholesterol medicines, I mean, the magnitude of the risk reduction itself has really had us very impressed. So we're saying in the medical community now that obesity is a disease. We have to do better to treat it. And it's not just the primary care doctor that treats it, it's every doctor that you see. And 40% of us are suffering from this disease.
And I just have to jump in because we were just talking about Wegovy. Does this also apply to Ozempic and Mounjaro?
So, as you know, Ozempic is the same drug as Wegovy, semaglutide, but it's just marketed for diabetes instead. Mounjaro is kind of the new and improved first generation of these. It's a GLP and a GIP, so it's got a second component in it. I really suspect that this is going to be what we call a class effect, meaning that the different medicines by different manufacturers of the same class are really going to have a lot of the same outcomes. Because if you think about what we're treating here, I like to think about it as the first domino. You guys played dominoes when you were kids?
Oh, absolutely.
I definitely did.
I never did because there's too much work setting them up and then cleaning them up. But
you just lay them out.
No, I think she was thinking
like
the whole
the
domino.
Oh, I thought she meant dominoes like on the porch.
Yeah,
Wait,
You literally throw them on the table.
Yeah, I was like, you set them. Okay, I get it.
So so the first domino falls, all the rest fall. Obesity, we've realized, is the first domino. It is the root cause. So you're treating the hypertension, you're treating the high cholesterol, you're treating the inflammation, you're treating the diabetes, you're treating all of those things.
Let's talk cost, Doc, because I know this is really expensive and not affordable for a lot of people that want to get on these drugs. How does that look like when we're looking towards the future?
So this trial might change that too, Jeff, because up until now, the insurance companies have been okay to say this is an obesity drug, and we don't cover cosmetics. We don't cover obesity. Now that we've got a medical benefit, this is not an obesity drug. This is becoming a heart disease drug. And so that price tag of $1,350 a month, hopefully next year, once the label expands, and they'll apply for a label expansion later this year, once the main trial has been reported, will help the cost be more affordable. Now, I do want to make sure that we keep safety in mind, because we've been talking about this being a wonder drug and all the things that it does, but as we start giving it to more people, small safety signals could start to get amplified. We've talked about self-harm emerging. We've talked about the stomach paralysis that someone had with these drugs. So I think we really need to pay attention to safety as we roll this out.
Absolutely.
Sorry, Doc, I was making a face when you were talking and I was listening to something. That's why I was like, what? And then you were looking at me and I was like, no, not you. Never mind.
Do you want to ask this question?
No, I
okay,
don't.
let me ask you. I will ask it. We got a ton of questions about acid reflux because this is really scary. Acid reflux drugs, after a news story this week, link them to higher risk of dementia. What is going on? Break this down, because I know everyone in my family has heartburn, acid reflux, and they're on these drugs right now. Do they get off them?
My mom does too. No, don't get off of them because acid reflux left untreated can cause esophageal cancer, can cause gastric cancer, can cause all kinds of problems. But this is the second study, and there might be more, that has actually shown this potential association. Now, I want to be clear that this is an association, not a causation, meaning that people who took these acid reflux drugs for over 4.5 years had about a 33% higher chance of dementia. Now, could it be something else about these people that's making them take the acid reflux drug? Maybe they're drinking more alcohol, and so they're getting more acid reflux. Maybe they're going out to eat more restaurants or what have you. I don't know the answers. They tried to control as best as they could for those other variables. But we have to remember this is not a causation, it's an association. But to me, it raises a bigger question, which is that, you know, you fix one thing and you might break another. So it's really important when we start to put people on these medications for long term, whether it's blood pressure, acid reflux, what have you, that we have robust monitoring in place. You don't just put it out there and let them do their own thing. And with acid reflux medicine, which is available over the counter, you can get it at Costco.
And just for clarification, we're talking Prilosec, Zantac.
These are proton pump inhibitors. So it's like omeprazole, pantoprazole. So they're different types of acid reflux medicine. Zantac, for example, is a histamine blocker. So it's a different class.
Oh, that's good to know.
Yeah.
That's good to know.
So it has to end in zol, omeprazole, pantoprazole. That's how you know it's the one that we're talking about.
Okay, let me talk and switch gears one more time here. We're talking about those full body scans. Kim Kardashian famously just did one where she's like, look at me, whatever. Lots of celebrities are promoting them. Are they good? They're supposed to find cancers really early. Like, it looks like a wonder treatment.
Why is she in scrubs?
I don't know. But tell us about it, because I was thinking of maybe getting one like once a year, maybe, but they're very expensive.
Ridiculous.
She's in scrubs because she's playing mind games here.
Yes.
They're pulling at your mind strings, making you think this is a medical thing. There's not a single medical society or expert who recommends a full body scan as a screening modality for cancer. The diagnostic yield, the likelihood that it's going to find something that's serious, is less than 2%. You're actually more likely to die in a car accident in your life than to find something on this. And you're very likely to find false positives, which are incidentalomas, incidental findings that would never have declared themselves, that you then have to chase with biopsies and other procedures.
That mean nothing, really.
And cause a lot of anxiety.
Right.
So I do not recommend these scans at all. Talk to your doctor about your cancer risk, your family history, whether you need genetic testing. I'm hoping we start developing blood tests that can detect cancers microscopically, not waiting for them to become large tumors before a scan like this picks them up.
Which is what Theranos wanted to do, but was defrauding all those people about. Thank you so much. Fascinating. DBL Nation, listen to Dr. Kohli's podcast, The Heart of Medicine. You can check it out on Spotify and Apple. Again, thank you so much, Doc.